I'm Todd Shryock, Managing Editor of Medical Economics, and I'm here with Heather George, Chief Revenue Officer of Patient Co., to talk about telehealth and revenue cycle management. Heather, thanks for joining me.
Oh, thank you so much for having me, Todd.
So, Heather, why has the health industry been reluctant to adopt telehealth and the use of other digital tools prior to the pandemic?
You know, Todd, that's a really good question. Prior to the pandemic and the current situation we find ourselves in, there were many telehealth tools. And in fact, a lot of organizations have deployed those tools in a legacy model, I would say. However, really the reimbursement around telehealth visits has been very cloudy. There has been a lot of concern about the patient interaction and anything that may be missed via telehealth visits. And I think in general, if you think about the healthcare industry, it's a heavily regulated industry, probably, next to banking, one of the most regulated. And so it's been unclear as to how legacy telehealth solutions or even telehealth solutions that are being used now comply with all of those regulations. So if you put that together, it creates a very challenging water to navigate, and it creates an area with a lot of uncertainty, and a lot of providers are very risk averse when it comes to uncertainty. So they want to make sure that they're doing everything they can to care for their patients in the best interest of the patient, and have been more focused on that than they are necessarily around convenience.
I see. How does the increased adoption of digital tools by health systems impact the relationship between the physician and the patient?
I think that patients will continue to trust their providers and are actually looking at the adoption of telehealth in a good way, where patients are now being able to be seen in a more convenient manner. They can schedule their own appointments in many circumstances, and they can connect with their provider in a digital way that gives them confidence that they're remaining safe from the pandemic. The connection and the social face-to-face interaction is something that many are concerned about with the long-term use of telehealth, but ultimately the rapid deployment of telehealth right now is actually giving patients a lot more comfort and a lot more trust in their provider, that the provider's looking out for their best interest. So I think, telehealth really is here to stay. This is something that as we prove it out, we see that patients are lining up and talking to their providers through digital means, whether it's Zoom or telephone, et cetera. And those things are not going to go away in a post-COVID-19 world. Patients will just be too used to the convenience of it.
So with the increased use of telehealth by health systems due to COVID-19, what does this mean for revenue cycle management?
So the good news is that CMS has responded really well in creating COVID-19 codes and really expanding, as we saw through several legislation measures. They have really expanded the number of codes that they will approve, that they will reimburse, and we'll see a lot of telehealth visits come through as normal office visits. So from a reimbursement, the visits that do take place, you can anticipate based on most recent legislation that those codes will be reimbursed at a better level than we've seen historically. So that's a bright spot in all of this. The longer term implications for larger organizations, health systems, et cetera, I'm particularly thinking around specialty practices that rely heavily on surgery. Those postponed visits will certainly have an impact to the revenue cycle. We're seeing that already, and we anticipate to see that until we can get those visits rescheduled. That said, those visits will happen. It's just a question of when. And the anticipated 50 million cases that are seen nationally, when those do get rescheduled, it's going to be more important than ever to have digital tools for appointment scheduling, digital tools for reminders, and even tools that allow you to collect a certain percentage of those surgeries up front. So digital will help organizations prioritize and help them understand who needs to be seen when and how they can triage for the most important and urgent cases that were previously seen as unnecessary or non-emergent cases.
Should patients using telehealth services expect to have digital payment options and online help for financial matters?
Oh, absolutely. I think that patients can expect to have digital options for virtually every point of interaction with healthcare, whether it's online appointment scheduling, whether it is a payment option. Many health systems are actually extending out their payment offerings and giving patients the opportunity to pay over time. Where historically patients would have to call in to the provider or to the organization and ask for help, we're seeing health systems actually create self-service tools so that the patient can go on and onto a portal through their device, whether it's a laptop or a phone, and create a payment plan that fits with their needs. If you think about the average American we're in a subscription economy, right? And the average American can't afford over $200 in medical debt in any given month. So if you have a situation where your patient owes more than a given parameter, and you know that there's a willingness to pay, but maybe not an ability to pay, it's very smart to think about digital tools to roll out payment plans and give patients options to pay digitally.
So, what types of digital tools are available to help healthcare providers collect payments while also providing a good customer experience?
Yeah, that's a great question. At Patient Co, that's really the core of what we've been doing for a long time. There are certainly others out there, legacy EMR companies, or even other payment tools through banks, et cetera. The difference is that with Patient Co, all of the digital tools are tied together on a unified platform. So the tools that are out there can offer payments accepted via paper check and digitize those so that patients can feel confident that those are available. We offer, obviously, credit card transactions. Some hospitals offer, or health systems offer, prompt pay discounts. So the ability to present any payment option to a patient in a digital portal is something you should really look at. You should also look at tools that integrate natively to your EMR or your HIS system if you're a healthcare provider. You want something that feels seamless, where the payment that's received from the patient, or even that's processed through a telephone call or any other way, that presents back and reconciles to both your bank account as well as the patient's record, so that there's not any disparity and the patient doesn't feel like their payment that they tried to make, specifically during these times, is delayed in posting. You don't want to end up in a situation where you're billing a second time for something that somebody's already paid. So making sure you look at tools that offer flexibility, that offer compassionate care to your patients through their financial journey, and also give them the assurance and the trust that that patient's payment was received and reconciled back. Those will go a really long way in building trust between providers and patients.
Okay. What are the options for self-service digital payments, and what's the benefit?
Self-service digital payment options, it's an interesting topic because you start to get into the complexity of the psyche of dealing with a patient without a self-service option that suddenly has to call and admit they can't afford a bill. That is a big problem with healthcare payments. Most patients don't want to call and admit they can't pay a $200 bill. They would be willing to go on, however, and sign up for a $10 payment plan, perhaps, a $50 a month payment plan. We've actually seen where patients enrolling in self-service options are willing to commit to a shorter duration of payment plans, and they're willing to be honest about the amount that they can afford in payment versus being on the phone with someone feeling shame, feeling that they can't afford their bill, and feeling like they need to ask for permission to not pay the full amount. And that's something that's very different with healthcare. Healthcare has always been 100% pay in full. There aren't really flexible payment options like a credit card company who has a minimum balance due. Patients are looking for that kind of convenience in their entire healthcare experience.
Many patients prefer to communicate via text or chat. How can these communication channels be used to boost payments and increase customer service?
Yeah, we at Patient Co, we've actually seen, we have messaging function and chat functionality, and these are great tools to help automate a lot of the questions. Most patients don't understand their healthcare coverage. They don't understand why they owe what they owe, and they don't understand why they were billed for something that they don't understand. It's normally complex language. It's normally medical jargon and terms. And when you're able to translate those terms, patients understand. Through text or through chat and messaging, patients are able to reach out to their provider where they don't understand why the bill became due, why they don't understand what they owe. And a lot of these conversations where patients are historically calling, they need to really be calling their insurance provider, or they need to understand what their EOB says, all of these kinds of things. But with messaging and with chat, you can set the technology up to respond, whether it's armed by a live person or not, to handle basic questions, to upload change of insurance, to communicate around financial policy. These are all great options and great use of digital communication tools.
So how easily do these financial tools integrate into telehealth systems, and what modifications are typically necessary to get started?
Yeah, that's another great question. So most telehealth solutions currently have a payment vector that the patient puts in their credit card before they're ever seeing the provider. The hiccup to that and what we're navigating now is the fact that those telehealth visits don't ever run through insurance. They're normally a flat fee. And to what I was talking about earlier around the reimbursement now being about of an office visit, it's a different financial mix with legacy telehealth type offerings. In this world, what we see is that utilizing your current payment processor, your current solution, and other digital tools, you can connect your payment mechanism to the traditional workflow that you have. And then the patient can pay for that visit the way they would pay for a traditional office visit or a traditional procedure. So the payments, the existing payments infrastructure that you have, if it's fully integrated and it's providing you a solution, it is very wise to run through that and process the claim like a normal insurance claim, a normal office visit, a normal visit. So in those ways, you can be sure that you're not getting revenue leakage and that the long-term patient satisfaction remains intact because you've utilized the patient's insurance and they're satiating portions of their deductible. So those are things that you really want to think through when you think about, telehealth and the visits. You want to make sure that the patient is getting credit for that through their insurance.
Is there anything else health systems should think about when it comes to digital financial tools?
I think across the board, it's a good idea to think hard about digital, period. Digital is here to stay. We've seen a huge influx of telehealth. We've seen that surge rapidly as people shelter in place. And they still need to talk to someone if they have a sinus infection, or they still need to talk to someone if their child fell somewhere in their home as they've been stuck at home, right? They still want to be able to talk to a caregiver. They want to talk to a provider. They want to be assured. They want to understand if symptoms they're producing are related to coronavirus and potentially a COVID-19 infection. Digital tools are here to stay, whether it's telehealth, whether it's appointment scheduling, whether or not it's flexible payment We have to realize that the entire healthcare experience for most patients has historically been inconvenient. However, it's been very personal. So you go to your provider, you rearrange your day because you care about your provider. It's very personal to you. In order to make the entire experience personalized, you need to look at digital tools that can also help tailor and be personalized to the patient. You don't want a patient who's incredibly loyal to you because they feel like they have a personal connection with you. You've cared for them for quite some time. You don't want that patient to then feel disjointed or broken. You don't want broken trust because they have a poor billing experience or a poor scheduling experience. It's really important to look at tools that help tailor communication to the patient, help them understand what options they have to pay their bills, help them understand how you're in the business of not just compassionate clinical care, but also compassionate financial care, so that patients can really feel connected and earn trust and maintain the trust in providers as they carry forward during this crisis and beyond.
Heather, thanks for talking to us today.
Absolutely. Thank you so much for the time. It's been my pleasure, and I hope you and your family and everyone stay healthy and stay well. And for now, keep home. We'll see you soon.
All right, thank you.
Thank you, Todd. And don't forget to check out the websites of these MJH Life Sciences brands and more to get additional information across the medical field.